doctor.
Good morning. I'm Dr. Parul, dermatologist, NMC Sharqan. Today we are going to discuss about acne, which is also called as pimples.
Doctor, what is acne?
Acne is a chronic inflammatory skin condition. It happens due to excess secretion of oil from the oil glands and due to the clogging of the pores. It happens in both males and females. It can happen on face, chest, front shoulders, back. It's a very disfiguring disorder.
How did it happen, doctor?
It can be due to the genetic influence, or due to hormonal influence, or due to stress. When our oil glands, which are also called as sebaceous glands, they started secreting excess oil. Along with this, another phenomena happens. That is, there is clogging of pores on the skin. Now, this excess oil which is secreted doesn't get a place and it starts clogging, starts accumulating. Because of the accumulation, the bacteria comes into action. Now, wherever there is bacteria, our WBCs have the tendency to fight this bacteria. And this starts fighting, which we visually see as a pustule. From here onwards, what starts at blackheads, whiteheads, goes to form the pustules, then cysts and nodules. This is how the pimples starts flaring.
How to take care of skin prevent this formation?
We all know that those who have pimples have an oily skin. A proper skin care is required for them. We have to clean our skin with micellar water, followed by a good salicylic acid base or a benzoyl peroxide based cleanser. Please don't forget to moisturize the skin after cleansing. This is very important because if the skin is left dry, it will send the message to the brain, and brain in turn will direct the glands which are secreting oil to secrete even more oil, and then it will land up into flare of acne or flare of pimples. So it's very important to moisturize the skin even though the skin is oily. Usually a water-based moisturizer should be used. Following this, the sunscreen should be applied, which can be from 30 to 50 SPF. Please don't forget the bedtime routine of a retinol cream. Retinol-based creams or AHAs or BHAs-based creams, they not only help in reducing the flare of pimples, drying them up, but also helps in reducing our fine lines and wrinkles by stimulating our collagen and elastin. Please never try to pick your pimples because in doing so, it's going to spread the bacteria from one place to another. Nowadays, we are all facing a pandemic situation where we all have to wear a mask. It is very important. But due to overwearing of this mask or due to the material of the mask, it might irritate the skin and it might disrupt the skin barrier, leading to increased sensitivity of the skin, which in turn can cause a flare of acne. Also, behind the mask, a sweaty atmosphere can accumulate, because of which, again, it gives a very good condition for the bacteria to proliferate. Hence, if using a mask, please take care, use a disposable mask. If homemade mask is being used, Please use a cotton mask and avoid polyester masks or synthetic material masks, which irritates the skin. Also, please take care not to use any new makeups during this time, because a new makeup or a new product might be very good without the mask, but in a sweaty environment, it might act as an irritant for the skin and hence can again lead to the flare of pimples.
Is the role of diet in this acne?
Yes, diet has a very important role in reducing the acne or even forming the acne. Diet which is rich in vitamin A, zinc, B5 helps in reducing acne. For example, our greens, which is spinach, broccoli, cabbage, carrots, walnuts, almonds, pumpkin seeds, fish, eggs. These are very rich source of vitamin A, omega-3, B5 and zinc. These help in reducing the flare of acne as well as in formation of new acne. Please avoid milk and dairy products because they contain excess androgens, which might play a role in increasing the acne. Yogurt is alright. Also, there is one most important thing. Please reduce sugars or avoid sugars in the diet. These sugars, for example, colas, juices, cakes, pastries, they lead to a condition which is called as insulin resistance and PCOS, polycystic ovarian syndrome, which is very much responsible in females for a flare of acne on the face. Hence, diet plays a very, very important role to prevent acne.
What happens if acne is not controlled by skincare and diet? Why should do that?
Usually, diet and good skincare can take care of the acne. But in cases where still the flare is there, then one must consult a dermatologist. The dermatologist will do a proper examination and categorize the acne into mild, moderate or severe depending upon the severity of the flare of acne. He or she might start a topical cream along with oral medication. This oral medication might be antibiotics or even isotretinoin tablets. Before starting these, the dermatologist might advise for a few blood tests which might include hormonal analysis as well as ultrasound to rule out PCOS. Sometimes to continue these oral tablets, one needs to do few more blood tests. In case if the dermatologist starts oral treatment, then they might need monthly blood tests. We at our NMC Sharqan, we are providing both medical treatment as well as aesthetic treatments for the acne. These aesthetic treatments include chemical peeling, dermabrasion, microneedling, plasma therapy, and fillers for acne scars. For any further inquiry or for the treatment of acne, both medical as well as aesthetic, you can contact me. I'm available in NMC Sharqan. You can call at the given number for my appointment.